Let's keep fighting together to stop the pandemic, support most vulnerable and build a back better in solidarity. An optimistic tone set by the United Nations Deputy Secretary General in her message in the One World Together at Home broadcast event that took place this weekend, raising millions of dollars for the World Health Organization's COVID-19 Solidarity Response Fund. But as the DSG has also articulated, the pandemic and the measures to mitigate it are already having a very serious social and economic impact. Amina Mohammed joins us now via Skype from the United Nations headquarters in New York. DSG, good evening and welcome to African Perspective.
Good evening. Lovely to be with you.
Before we start off this conversation at DSG, we'd just like to extend our condolences to you after losing one of your colleagues who worked in the Nigerian presidency, Abba Kairi.
Yes, Abba Kairi was indeed one of the closest colleagues that we had, and it was a backbone in our cabinet, and we will miss him. But it shows you that COVID knows no boundaries. It can happen and be, anyone can be at the end of it.
Yeah, and saying that that it knows no boundaries, what do you make of the solidarity response that we've seen from the various states in trying to combat COVID-19?
Well, I think that certainly that it is a global pandemic, a crisis of the human face, and we've said that only a global response can deal with this. I think the intentions so far have been good. However, what is it that we have actually managed to see in the last few weeks, where we have engaged with the G20, where we have had the IFIs come together, and where we've had calls from African presidents on the necessity of a debt standstill? Some of the first collective steps, I think, have been very hopeful. But it's not enough, and we need to do a lot more to make sure that the liquidity, the gap that is needed to be filled in many developing countries is actually attended to. So a global response, I think that you're seeing everybody come around the table to try to do that, but there are many challenges to it to be worked out.
And how do you fill that that particular gap? Looking at, for instance, what the United Nations Conference on Trade Development has indicated around the 1 trillion rand that should be made available through expanded use of special drawing rights at the financial institutions.
Again, I think that this is a very positive step, and Kristalina Georgieva is aware of some of those incredibly difficult situations everyone finds himself in, so has really made the call for that to come about and to also be deployed as rapidly as possible. And so I think that it is available is a really good first step. I think it needs to be deployed in an urgent response. It cannot take the same timelines that we would normally see. Otherwise, we're saying that we're not getting the emergency response that we need to fill these gaps.
Yeah, and the distinction there is that while the UNCTAD has called for 2.5 trillion, only 1 trillion has been made available. So who can then fill that particular gap? Or how do you fill that gap?
Well, I mean, I think here we've seen our leaders in Africa come forth and ask for more creative ways where countries who have the ability to voluntarily make those funds available could do so. And I think there have been so far good responses. It's still not enough, and I think we still have to keep the pressure on countries to open up that space to make more funding available. It's clear that we are going to need double figures of GDP to respond to this, and where some parts of the world are able to do it, others are not, and we have not seen that gap filled yet, and yet we've had some time to really consider this. As it were, Dr. Tedros talked about when we will begin to see COVID hit developing countries in the manner that we see it here in the north. Not much time left, and I think that this is what we should have really tried to work towards.
Is it unfortunate or a step back, considering that you have the United States, for instance, that have said that they will hold back funding for the WHO?
I don't think that it is a step back. We would prefer not to have that stand taken. I believe what we have here is the WHO and Dr. Tedros doing the best that they can in this situation, and that right now we need to fight COVID and overcome it. There will always be a time for us to look back at what everyone has done, and accountability put a discourse. But right now we need unity behind the WHO and its leadership to ensure that we get the job done. This needs a global response. And so I think that, that sort of creates perhaps a distraction that is not what we need right now. We need everyone to get behind the efforts that have been made. And at the forefront of this is the WHO and its partners.
Yeah. Does the United Nations then take a similar stance when it comes to the accusations being leveled against the WHO and its initial response, as well as allegations being leveled against the Chinese government, saying that let's take a step back, let's deal with COVID-19, and there will be processes around accountability that will be dealt with at a later stage?
You said it exactly right. Right now, the battle is to defeat COVID. There will always be a day of reckoning. But today, it is unity and solidarity behind getting the job done. People's lives matter, and that's what we need to put at the front of the agenda.
Has there been any state that has been in contact with the United Nations to try and push for an international investigation, whether it is at a later stage? I've heard, for instance, from the Australian government saying that there must be such an investigation.
No, the United Nations to date, I'm not aware that we've had that submission.
Okay, let's quickly then speak about the economic response and how the economies in various countries are taking a knock. And we've heard from the Secretary General saying that recoveries from the crisis must lead to economies that are inclusive and sustainable. How do we get there?
Well, I think, as you heard Dr. Tedros talking about the health challenges and how we must build back better, we have always had on the agenda frameworks to try to get sustainable development done. In this crisis, the opportunity has come. Now, we have an emergency not just in health, but also on the socioeconomic piece. And on the socioeconomic piece, it is a dislocation of the economy, of the informal economy, the formal economy, because of the actions we have to take to stop the transmission of the virus. And so while we look at the stimulus packages to ensure that we try to keep jobs afloat, or those that are taken out, learning happening at home, all our businesses, in fact, happening at home, we need to make sure that we can build back better from that. So there could be online education means that we need connectivity. Connectivity is not there at the scale that we need it, and this is something that we could invest in now. Same for energy transitions and off-grid. That's another part of it. Social protection floors and cash transfers to people, particularly those that are faceless to us, that we don't have identities for. This is actually going to be a time where we could profit from that, and we can put that in place. Another
conversation to be had is, of course, the discussion around economic sanctions that are faced by various other countries. What's the United Nations take on this, and how you can help certain countries like Zimbabwe, for instance, like Cuba as well, to make sure that they're able to respond to COVID-19 while under economic sanctions? Or is the United Nations saying that let's put that aside for now?
Absolutely not. The UN Secretary General has had the call for ceasefires, because the context in which we are dealing with COVID, we really need peace and we need a ceasefire. And that has been signed on to by over 120 countries so far. In the same context, we've asked for the lifting of sanctions, because that also will help enable countries that have sanctions imposed upon them to deal with the supplies that they need for the health of their people. So we have made those two calls, and we continue to put pressure and to bring the global community behind that until we get the job done.
What are the consequences if those sanctions are not lifted?
Well, people suffer. I mean, at the end of the day, if medical supplies cannot get, the treatment cannot get there, the vaccines cannot get there, the infrastructure that is needed to build the water and sanitation to prevent the spread of the virus, then of course people will die. That's what it means. And that's what we're trying to do. We're trying to reduce the numbers of people that will be affected by the spread of COVID. And, COVID travels across borders.
Yeah.
Where you have sanctions in a country that come under pressure, people will go across borders if they find that they're not safe within them as a result of the inability of that country to provide health services.
And there's also the concern, of course, around world hunger. And earlier on, we had the briefing from David Beasley, who is the head of the World Food Program, indicating that the number of suffering people from hunger could increase from 135 million to 250.
Absolutely. I mean, this is what we're saying. You take people out of an economy. Most of it is your daily living. It's subsistence farming. It's subsistence in terms of that daily earning. And once you take people away from that, then the likelihood of hunger is very, very high. And I think this is where we are really asking for the development part of this agenda to be treated as an emergency. People should not have to choose between whether they are facing the crisis of COVID and the health or hunger. We should address both at the same time. There is a prescription which is having an effect on the patient right now that could create another pandemic on the economic side. And we shouldn't have to choose between one or the other. We should be addressing both at the same time so that we prevent an even bigger humanitarian crisis.
And with that said, also including migrants as well as foreign nationals who may find themselves away from the country, those who are in the diaspora, how do states then respond to that? Because what we've seen in South Africa, for instance, is the South African government has announced a 350 Rand or an $18 grant for people who are unemployed. But the big question for some NGOs is, what about migrants who live in the country who are also affected by these economic lockdown?
Well, every human being has the right to expect to have their issues addressed for survival. It's a basic right. And I think that what we're finding ourselves in is an unprecedented situation where we don't have the answers to everything. We have to create the policies and the spaces to make sure that everyone within our borders is attended to. And that includes migrants and includes internally displaced people, refugees. These are all human beings. This is a human crisis. It's one of a global nature. There is no one that has not been affected. And I think that this is where we stand up as a human family. And we try to work across the red tape that there is. Today, we ought to be standing shoulder to shoulder as a human family.
Do you coordinate that type of response from a national government level, or do you escalate it to have it, for instance, at a continental level, or let's say the African Union gets involved, and this is the African Union's response to people who are in the diaspora?
Yes, I think it is first and foremost a national issue, but always when it becomes a cross-border issue, institutions like the African Union have an important role to play. And I think that, right now the African Union is headed up by a leader that everyone has respect for and that understands these issues. So I do think that the African Union is addressing this. I think that they will then work with international organizations like the United Nations, and that, humanitarian law and the respect for human rights will be at the forefront for every African.
What about people who are in the diaspora who are trying to travel back to their homes, but however, though, the countries are not responding, for them at least, positively to try and evacuate them and get them back to their home states?
This is very difficult. I mean, we really have huge challenges with travel right now. And I think where people are and they can remain and to make sure that they are safe indoors, this is what needs to happen. Where there are possibilities and countries are making the efforts to repatriate their nationals, then it is happening. I think in some places it's happening, other places it's slower to happen. The ideal today is not always possible because the competing demands on very difficult resources are certainly there.
We're also seeing shocking numbers in relation to gender-based violence escalating during this period. Some countries even reporting that the number of GBV cases have increased by more than 30%.
Absolutely, 3 times the normal rates. We are seeing it across the world. This is another silent pandemic, if you would. It's a very serious one. Again, the SG's call on gender-based violence, followed up by his policy paper on women's rights and the issues are things that we need to take into cognizance as we are designing these programs to address COVID. It is violence against women. It is violence that children will be seen in that environment, and so will be affected because it is in that space in the family. But we're also seeing online a lot of child abuse online, and these are all issues that need to be taken care of. I mean, the other side of it, of course, is there's many mental health issues that are coming out for our health workers on the front line and in homes.
Yeah. Final one is some leaders are saying, of course, there is some light at the end of the tunnel. So the big question would be that with the UN's General Assembly in September, the UN 75th anniversary, will that still go ahead as planned?
By the grace of God. Yes, I'm very optimistic that it will go ahead. I think that what you will find is that we are going to become even more creative in this space. Today, you and I are having this conversation across 2 continents, and we are communicating with a huge audience. The General Assembly will continue to function, and it will find a way to meet and to address the needs and the aspirations of people around the world that belong to this incredible institution.
Thank you so much, DSG.
You're welcome. Thank you. Be safe.
Thanks a lot. We'll try to be safe, and always remember to wash those hands as well. That was Amina Mohammed, the Deputy Secretary General of the United Nations, speaking to us live from New York.